afternoon. We are talking today from the Canadian Mental Health Association and Hotel-Dieu about a new program that was launched just last week, the Mental Health and Addiction Urgent Care Center. So this is another tool that is available in Windsor and Essex County for those experiencing mental illness and addictions, and a place to go for help. So it is located at the Canadian Mental Health Association Windsor-Essex County branch. And today I have with me some special guests to share some more information and insight about what is being offered at the Urgent Care Center. So Claudia Dembord is the CEO at CMHA, Windsor-Essex County branch, and the executive lead of community mental health at Hotel-Dieu Grace Healthcare. Sonia Grabowski is the vice president of mental health and addictions at Hotel-Dieu Grace Healthcare. Tammy Kodak is the integrated director of outpatient services between CMHA and Hotel-Dieu. And we also have Charlie Moscatel on the line. He is a social worker with the Urgent Care Center. So thank you all for participating in this webinar. So Claudia, what is the intended purpose of the center, and who should visit it?
So what we were hoping to accomplish, particularly given this pandemic, we wanted to ensure that we were diverting individuals from attending the emergency department at the acute care hospital who really didn't need emergency care, but might very well need urgent care. And so we decided that we would come together with our collaborative partner, Hotel-Dieu Grace Healthcare, and offer this service. And the service is intended to be provided to any adults 16 years or older who may be struggling with an urgent mental health and addiction challenge or need, that if it's not attended in a timely fashion, it may worsen and actually then result in requiring, more emergency, acute type care. And we really want to be able to keep clients safe during this period of time when so many services are closed. And there certainly is a fear of attending places where there are lots of people of contracting the virus. This was an opportunity for us to provide, short-term support and hopefully avoid people having to attend the hospital for something serious.
And Charlie, what should individuals expect when they visit the Urgent Care Center, and maybe also mention all the what services are offered?
Okay, so I think we're trying to wrap our heads around all that here as a new team being formed, but as I think people know, the hours are, Monday, Wednesday, Thursday from 11:30 to 7:30, Tuesday, Friday from 8:30 to 4:30, with the understanding that if someone attends, shows up at, let's say, 7 o'clock or whatever, that if there's follow-up appointments necessary with that individual, then those are scheduled up to a maximum of hopefully 3. But the idea is to, get somebody in kind of hopefully through one session or one visit, get whatever needs met for that client, based upon the assessment, based upon the intake, and then refer them on to either other services in the community. Of course, we need to have a good understanding of what those services are, what limitations are for services during COVID, but are there services in the community or services within Hotel-Dieu Grace and CMHA?
Right, and you don't need a referral to walk in the door, correct?
No, it's self-referral. It can be a self-referral. Yes, you can just walk in.
Okay. And Cammy, maybe can you tell us when someone should still visit the emergency department versus coming to the urgent care center?
Sure, it's just kind of to speak what Claudia said. The Mental Health and Addictions Urgent Care Center is really targeted for those individuals that are at an urgent need, for mental health or addiction supports. These individuals basically, are at risk of rapidly deteriorating if they can't connect to community supports in real time. So that's where our target population is. But individuals, that still need to go to the ED, or anyone that obviously is at risk to themselves or with others in the community, anyone that's experiencing any type of, psychotic-related episodes. Also looking at anyone who has any kind of physical health concerns or medical complications related to withdrawal management. Those individuals should still seek services at the emergency department. And at any time if somebody's unsure, they can always contact our main line here, and one of the clinicians would be happy to help you navigate where the appropriate place for you to be is.
What phone number would that be, Tammy?
That's the 519-257-5111, and it's the main extension, which is 77968. Thanks, Charlie.
Okay.
Yeah.
Thank you.
Yeah.
So there is also the Mental Health and Wellness Center that is still operating at the Transitional Stability Center on Ouellette Avenue. Sonia, when should someone access that center?
Just follow the normal process as one would have pre-COVID-19 days. Anyone who's interested in that intervention that's going to take a little bit more than the one visit. So this would be your normal referral process. This is for individuals who have the ability to wait a few days to get into services. So this is what's going to distinguish between what's going on at the Mental Health Urgent Care Center versus at the Mental Health Wellness Center. And if you're ever in doubt, come see us at either location and we'll make sure you get to the right place. And don't forget, we're still operating our 24 hours crisis telephone line, as well as we have crisis walk-ins. So once again, if it's a crisis situation, please contact our crisis number, and that's 519-973-4435.
So Claudia, the Canadian Mental Health Association is also still operating. Who should access the services here, and what is the process of becoming a client? Oh, if you're on mute.
Thanks, Kim. CMHA provides really more intermediate care for those who have, a situation, as Sonia has indicated, that might need a longer period of time to work through, and who don't require something extremely urgent. So the best way to access CMHA services is either to call us at 255-7440, or you can actually go to the Crisis and Mental Wellness Center on Ouellette and come through that way. And our CMHA team are co-located there with the Hotel-Dieu staff, and they will provide an intake and assessment and sort out, what services are you best going to require, whether you're struggling with grief and loss and you need access to a bereavement program, or some of our justice programs, or case management, housing. Those would be, more longer term solutions to an issue, and that's the best way to get access to CMHA services.
Thanks. So I know in the interest of everyone's health and well-being right now, the best thing we can do is stay home. But we want to preface that by saying that if you are struggling with a mental illness and or addiction, that you should reach out, and there are services available in this community. So the Urgent Care Center is the latest service to be offered or added to this list. And also Family Services Windsor-Essex, in partnership with the United Way, has recently started a 24/7 support line for those wanting to talk to someone during this pandemic. So the good news is that providers are working together to provide more services than ever before, because we know that during this time, even the most mentally healthy people are having to adapt to this new reality that we find ourselves in. So is there anything else anyone wanted to add before we conclude?
I think I would just add individuals can access either the Hotel-Dieu Grace website or the CMHA website or any of our social media channels. There's lots of resources there. Even if you don't need something urgently, but you would like to, have a short-term means of doing some online support, like we have a program called Bounce Back, where you can work through a number of modules and then connect by phone with a coach. There are just lots of ways in which, in a more virtual way, we can continue to support you through these challenging times, as Kim has indicated.
Great.
And I would like
One
to
thing
add,
I would add is, Charlie, just the specialty around addictions when people present, kind of working through with them, again, what's available in the community and connecting to them to those services as quickly as possible, right? And of course, connecting them to whether it be medical staff through the CHC or very quickly to, psychiatry consult as well, which is, important service, as we know.
Right.
and the last thing I'd like to add, thinking it's the last thing, that we recognize that mental health can affect individuals across the lifespan. I know we've been focusing here with these services for individuals in our community ages 16 and older, though we do have services available, crisis services, as well as telephone services for families or young children, youth who require some support as well. And you can be, they can call the Regional Children's Center and Hotel-Dieu Grace Healthcare, and the number there is 519-257-KIDS, KIDS.
Thanks, Sonia. All right. Well, thank you everyone for your time, and be safe.
Thank you.
Thank you.
Thank you.